We've spent some time in the past looking at abnormal vaginal or vulval lumps and their causes. But would it surprise you to learn that some lumps that develop in the genital area may be perfectly normal? So what do I mean by perfectly normal? I can hear you ask. First, lumps developing anywhere are generally not normal. However, not all of them will fall into the category of seriously abnormal lumps like boils, abscesses, or even cancer. So instead, I'm referring to a type of lump that develops in or around the vagina and the vulva due to a temporary change in the body's physiology, or it's a type that develops and doesn't cause any harm. In most cases, the lump may not require any treatment and goes away by itself. So in this video, let's explore 7 different types of lumps that could fall into this category I've talked about, how to identify them, and tell the difference between them and an abnormal lump. Number 1, vaginal skin tag. Vaginal skin tags are small, soft flesh or skin colored growths that develop around the genitals. They are harmless, not contagious, and not sexually transmitted. They only grow where there's skin, so even though we call them vaginal tags, they technically do not grow inside the vagina. Instead, you'll find skin tags along the inner or the outer lips of the vagina, that is the labia, near the opening of the vagina itself, along the groin or the inner thigh, or around the anus. Skin tags are common. They often appear in areas where the skin is folding, like your neck or the armpit. They become more common as we grow older. They can run in families or even develop during pregnancy. So vaginal skin tags tend to be soft. They feel like loose skin. They're smooth and often the same color of your skin, or a little bit darker. They are usually quite small, although some can grow to larger sizes. And generally, they are made of skin cells with tiny blood vessels inside them. Vaginal skin tags could most often be mistaken for genital warts because both of them can appear like soft, flesh-colored growths. So if you have a vaginal lump and you're wondering whether it could be a skin tag or a wart, here are a couple of ways that you can tell the difference. Skin tags are usually raised lumps on the skin. On the other hand, genital warts mostly lie flat on the skin. Skin tags feel smooth, while genital warts feel rough or bumpy, like a cauliflower. Skin tags usually grow alone, although you may have more than one skin tag in a particular area, but they're not bunched together. On the other hand, warts tend to grow in clusters. And lastly, while warts can go ahead to cause different types of symptoms, for example, itching, irritation, burning sensation, even bleeding, vaginal skin tags don't cause any symptoms unless they've been damaged or injured from irritation or something else. So speak to your doctor if you're still unsure about whether you have a vaginal skin tag or something else, or if the lump is causing pain, it's growing bigger, or really causing any other concern. Vaginal skin tags usually cause no problems, but they can appear very unpleasant. So there are several options for removing them if you need to. They can be cut off during surgery or tied off so that they fall away naturally. They could also be treated with freeze therapy or electric and heat therapy. Different treatment options depending on where they are located, their size, and so on. Next, vulval milia. Vulval milia are tiny cysts very often seen when we examine the inner and outer lips of the vagina, that is the labia. You may not even realize you have them unless you examine yourself from time to time, as we recommend, using a mirror. They usually grow about 1 to 2 millimeters and are more common in older women. They are light, sometimes appearing white or yellow in color. They may happen singly or in groups, and most of the time they do not cause any symptoms. You could have milia for a few weeks to a couple of months before they eventually go away by themselves. Otherwise, they can be treated with medicated creams, freeze therapy, or even surgery. Number 3, Fordyce spots. These were first described by an American dermatologist, Dr. John Addison Fordyce, in 1896. They are tiny lumps that develop where there is no hair on the skin. So think of areas around the lip, inside the cheek, or, yes, you guessed it, in the genital area. And so they are harmless, painless, tiny bumps that you might notice on the inner or outer lips of the vagina, that is the labia. In some people, they might even look skin colored. And they're basically oil glands of the skin that have become slightly swollen. If you have a vulval Fordyce spot, you might worry about sexually transmitted infection like herpes or warts. However, Fordyce spots are not sexually transmitted, and they can be easily distinguished from an infection like herpes, which comes with painful blisters. Fordyce spots are very tiny. Some are small as the tip of a sharp pencil, and they rarely grow more than 1 to 3 millimeters in size. Again, they may grow singly or in groups, and they usually will disappear by themselves. However, you may not like their appearance on your genitals, so they can be removed with medicated creams, freezing therapy, laser treatment, electric and heat therapy, or surgery. Some people suggest certain home remedies may help with removing Fordyce spots, but it's best to see your healthcare provider to make sure you've got the right diagnosis and they can advise on the appropriate treatment. 3. Skin gland cysts. Can you guess where the skin glands are located? I'll tell you in a moment. But the skin glands were first described by Dr. Alexander Skene, a British-American dermatologist from Scotland who died in 1900. They are tiny glands located beside your urinary opening in the vulva. Why are skin glands so important? Well, it's because of what they do for sexual and urinary health. First, tissues around the skin gland are stimulated during sex, and so they produce fluid that helps to lubricate the vagina for sex. They may also make mucus during orgasm, so some people believe they play a role in female ejaculation, and others have even referred to skin glands as the female prostate gland. Most times, skin glands cause no problems, but they could become irritated, infected, or very rarely they could develop cancerous. Now, what about skin gland cysts, which is what we're talking about today? Well, those develop when the space or the tissues around the gland become filled with fluid, forming a cyst. Skin gland cysts are rare, they're benign. Most often, they don't show any symptoms. Their usual size is under 1 centimeter, so think about the size of a pea. And if they grow, you may feel a lump under the skin beside your urinary opening on either side. In the rare case where a skin gland cyst goes ahead to cause symptoms, they may include things like pain when you're passing urine, pain during sex, frequently passing urine, or even experiencing frequent urinary tract infections. So most skin gland cysts do not cause any problems and do not require any treatment because they will eventually go away by themselves. But if you do need treatment, they can get drained, or you may have special surgery to deconstruct the cyst so it's no longer able to collect fluid and cause problems. Next, we have sebaceous cysts. These are a category of lumps that can develop around the vulva or the vagina, which could be considered normal because it generally doesn't cause any problems. The sebaceous cyst is a cyst filled with sebum, which is that liquid that helps to lubricate our skin and our hair. The cyst can also contain little bits and pieces of skin and hair material. Sebaceous cysts can develop anywhere in the body, and they're most common on the scalp, the face, the ears, your trunk, back, or groin. We're not really sure what causes sebaceous cysts to form. Sometimes we think it might be because of a blocked hair follicle or an irritation to skin that's close by, maybe from a scratch or from acne. All of this can trap cells and fluid, leading to the cyst being formed. Sebaceous cysts are harmless and they tend to grow very slowly. Usually, they don't need treatment unless they get infected. This can lead to painful lumps and swellings, which then will either need antibiotics or to be drained. Next, Bartholin Cysts. Now hold on, I know you're going to say, wait, what? Bartholin Cysts normal? Hang on a moment. Bartholin's glands are situated just inside the entrance to the vagina on either side. Their job is to produce the fluid that lubricates the vagina. When the tubes that move the fluid from the gland into the vagina are blocked, the fluid can become trapped in the gland, leading to a Bartholin's cyst being formed. Now, sometimes the blockage can happen because of irritation of the skin nearby or from an infection. Bartholin cysts are very common amongst women of childbearing age. They affect 2 in every 10 women. That common. Most of the time, when you develop a Bartholin cyst, it will go away within a few weeks without requiring treatment. Most of the time, you may not even realize it's present. However, a Bartholin cyst can become infected, and that's where the problem comes. It swells up and causes pain around and inside the vagina. This is when you should see a doctor because you might need antibiotics, you might need to have the cyst drained, and if this is something that happens over and over and over again, you might need a special procedure where the cyst itself is deconstructed so it cannot collect fluid any further. If you want to learn more about Bartholin cysts, glands, Bartholin's abscess, check out my video here where I talk a lot more about the subject. Next, vulval varicose veins. Varicose veins are swollen veins that we commonly see on the back of the leg. So why am I talking about them in a video on vaginal or vulval lumps? Well, yes, we commonly see them on the back of the leg. In addition to the back of the leg, they can also develop in other places, for example, the vulva. This happens most commonly when you are pregnant, and in fact, we think it might happen in 20% of pregnancies. Varicose veins developing in the vulva are usually caused by a combination of the hormone changes in pregnancy, the increased flow of blood during pregnancy, and the increasing weight of your baby's bump pushing on the womb. Progesterone levels are very high in pregnancy. Progesterone supports the growth and development of your pregnancy. However, one of the other things that it could do is to relax or weaken the valves inside the veins during your pregnancy. This can make blood pool or remain within the veins instead of flowing briskly around the body as it should do. Pressure from the weight of the baby pushing against the blood vessels in your pelvis also restricts regular blood flow. In addition to this, while you're pregnant, your body is dealing with an increased flow of blood. This means that some of the blood vessels may struggle to cope with this and they may swell or collapse. When this happens, it can affect particularly the small blood vessels around your vulva, leading to swelling in the area. Often it doesn't cause any symptoms and it does not affect your labor or delivery, and they would look like twisted, bunched or swollen lumps with dark bluish or purplish veins that pop up beneath the skin. Sometimes they can feel itchy or the entire area can feel heavy and uncomfortable or painful with a burning or throbbing sensation. Your delivery team needs to be aware of them, especially if you're having a vaginal delivery, so they can plan things properly and reduce the risk of bleeding during labor and delivery. Usually, vulval varicose veins have no treatment while you're pregnant, and they tend to settle within 6 weeks after baby is born. But if they're still persistent after a few months, there are treatment options. For example, they can be treated by removing some part of the vein. Alternatively, parts of the blood supply can be blocked off, or the veins themselves can be dried out using the same technique that we use for treating varicose veins in the legs or other parts of the body. We've been looking at a few lumps that can develop around the vulva or vagina that are generally harmless. However, please never assume. Yes, it's true, not all lumps that develop around the vulva and vagina are seriously harmful, like boils or cancer. But getting a new lump checked out is always important, especially if it's getting bigger. It's not going away after a short period of time, or it's causing any other problematic symptom. Check out this video here where I talk about abnormal vaginal lumps, and I'll see you next time.